All right, for day 3 of Heart Shaped Booty Month, we are going to do another assessment focused work day today, as well as give you a stretch, because after we work our glutes for the amount that we do, even though it's not super intense, it's not super loaded, the stretching will not only help you with kind of to help prevent soreness and just feel good, but it actually will boost the strength of your of the glutes. And also, of course, we're counteracting the fact that we were in a contracted state. So we'll throw in excuse me, a stretch here and there throughout the month that you could start incorporating, so that you do at least one glute focused stretch after we work the glutes, and you'll learn about 5 to 10 to take with you down the line. So today is about the glute med. Yesterday we did the glute max with the hip extension capabilities. Today we're going to do the glute med right here, which has two purposes. It helps keep your hip stable when you have one foot off the floor, and that happens when we walk. So pretty important. So it helps keep our hips from dropping every time we take a step, right? So it helps keep the hips square and level. It also helps with the abduction of the leg. So you could remember the difference between abduction, which is moving the limbs away, and adduction by remembering that if you're abducting somebody, you're taking them away. So the leg is going away from the body. And then adducting, I like to think of as, well, if you're coming in together, you're adding to something. Okay, so that's how I remember it. So we're going to work on the glute med abduction exercise, but before that we're going to do a really quick, simple but very effective assessment on whether we have an issue with the hip imbalance as well. All that is we're going to stand straight and take one foot off the floor at a time. And what we're testing for is that as we take that one foot off, are we shifting? Are we dropping at the hip? Okay. And then most importantly, we're checking for the imbalance. So we're going to check for how it feels on both sides. Okay. So are we more wobbly on the other side? And as you do it, the standing side is the one that we're testing. As you do it, you should feel your glutes really engaged, just to keep that leg up, just to keep that hip stable without dropping. Okay, so you should feel that engaged. All right, so see if there's any noticeable. This one is really good to do in the mirror, and instead of trying to just feel for it, okay, I want you to look at yourself when you're doing it and see if you have any shift in the center line, including your head. Okay, so your head should just remain in the same center line. So I don't really have an imbalance much in the hip stability, but that doesn't discount the strength. So now we're going to test the strength. We're going to take ourselves to the wall. Next to the wall, the leg that's outside of the wall, away from the wall, is the one that is being worked. So we're doing one leg at a time. So what we're going to do is, you don't need to hang on to the wall, okay? But if you feel unstable, you could just lightly have your arm, the back of your hand touching or extended, okay? So you're not leaning into this wall, okay? What we're going to do is, remember, the outside leg is the working leg. Put your weight on this leg through the heel. Bring your right leg up, okay? And then as you try to push your outside hip towards that wall, you'll feel a more intense contraction in your glute med, okay? And then drop it back down, relax it, and then contract it again, okay? So that should feel pretty intense. All right, so we're testing to see how many you could do before you can't do any more. Hopefully it's at least 10. Hopefully it's more like 12 to 15, okay? And then if you can't get beyond and actually towards that wall, meaning you're squeezing in order to get closer to that wall, then and you're kind of just staying more parallel, you're lacking strength as well. You want to be able to squeeze enough to drive this hip that's closer to the wall higher, okay, by squeezing through here. So do that for about, like I said, the 10 to 12 reps. And then of course you're going to switch to the other side, do the same thing, bring that knee up. You could tap the wall and then squeeze and drive your hip towards the wall. Let it relax, drive towards the wall, okay? And try to keep the rest of your upper body, your shoulders square, okay? So see if you could do 10. All right, and if you can't, then we're you're gonna focus on the strength of the glute med. All right, so now a really nice little stretch that we could do that we're going to use as both as sort of a stretch and an exercise at the same time. So this is an active stretch. And actually, this is a great way to stretch by doing both static holds, where you have the weight of your own body relaxing you into it, as well as doing active stretches. So here we're going to actually do both and get a little bit of glute working at the same time. So we're going to get into sort of a normal pigeon. Okay, so you can set yourself up by starting in the quadruped, bringing one knee in front, and this will highly depend on your current hip flexibility, okay? So a lot of people who are very flexible and have done a lot of yoga could probably bring this straight here while keeping both hips flat and square, okay? For others, what you could do is take a yoga mat or a yoga block, anything at all. I just grab this and place it underneath here so that you give yourself a little elevation, okay, to do the pigeon pose. And this angle could be like about 45, just as much as you feel like you could comfortably go. The more important thing here is we're working on the hips to be square. You could put your hands on the floor, you could put them up here and stand tall, okay? When you do so, you'll feel not only your hip flexor stretch, but you could feel your glutes firing as well. So what we're going to do first is do the activation part of it. So what we want to do is put our weight onto the whole entire length of the front leg as it's positioned, as well as the back leg that's straight behind you, and pretend that we're driving both into the floor. So as you drive down and contract, okay, then we're going to go the opposite way and pretend we're trying to lift both off the floor. You can't see me do it. I mean, I don't, not a lot of people would have the mobility and the strength to do so, but we're going to pretend. So we're going to contract as if we're lifting both this leg and the back leg off the floor. So we'll kind of end up lifting our upper body in order to do so. Then relax down, okay? And then press down and press down into the floor, both front and back leg. Press, press, press. And then do it again on the opposite side, okay? Now we're going to lift, 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 okay? And contract. So that's pretty intense for me, especially in this position. Now, so do what you can on this one. For this one, I would say 10 reps as your goal increment. And then when you're done with both sides, then we'll come back to the pigeon pose for the static or the gravity hold. Okay, so here what you want to do is position yourself in a manner where, as long as you're feeling a nice stretch here and you're not feeling any tweaks in your joints, from that position just let yourself relax down, meaning we want to act as if our lower belly is going to touch the floor. So not your head coming down to the floor, but your lower belly touching to the floor. You'll feel that stretch get more intense, and then as whatever height we're up here, if you want to use something to elevate, and just then relax into it. And that weight of your relaxing is going to give you that gravity hold, but you want to first make sure you set yourself up so that you're thinking about pressing your lower abs down towards the ground first, okay? And then bring it down, okay? So that's a huge difference versus just trying to hit the floor, right here, all right? So, because then now you have the tension of this reach, okay? You want to just fold yourself down and let yourself hang. All right, so you would do that stretch for 10, 15, 30 seconds, 15 seconds minimum, 30 seconds if you have more time, way longer if you have the time and inclination. All right, so then tomorrow we'll start with some additional exercises. Today was kind of brief. It was still a lot of explanation, but I think it was good. All right, see you tomorrow.